Welcome back to the Dr. David Show. We want to take your health questions now. Lori from Hot Springs says she has a lump between her shoulder blades and would like to know the cause.
Well, Lori, actually the cause of the lump could be anything. It depends whether or not you can feel it yourself or whether someone else has looked at your back and said there's a lump there. If it's just under the skin, the most likely cause is a condition called a lipoma, which is just an accumulation of fat that is of no clinical significance whatsoever. On the other hand, I can't really tell you what it is. There's no way that you should ignore this if you're concerned about it, because only a physician can look at your back and tell you what it is and reassure you that nothing is wrong, or alternatively make sure that an appropriate plan is put in place to help you. So don't ignore it if you're worried.
And Wilbert from Pine Bluff says he would like to know what causes small blisters on gums. He would also like to know if it is something common.
Well, little viral blisters, they usually quickly form little ulcers called canker sores in the gum or on your tongue. Are quite common. They're caused by a virus. They usually resolve spontaneously and are of no great clinical significance. They can be very painful, however. As long as the blisters are not on your lips, there's nothing really to worry about. A blister on a lip is more likely to be a cold sore, but cold sores don't generally occur on the gums.
And Joyce from Russellville says she takes Prolia for osteoporosis, and she would like to know your opinion, Dr. David, on this drug side effects and benefits.
Well, Prolia is one of the intravenous injections that are used to build bone in patients with osteoporosis. It really is very effective. It does work. The only problem with it is that it costs a great deal of money and should only be used if the generic alendronate or Fosamax does not work for you. Some people are unable to tolerate it because of indigestion and other adverse effects. But the intravenous drug is not necessarily better, it just is a lot more money.
And Karen from Bryant says she was in a car accident in March. As a result, she has severe nerve damage. She would like to know if there was any over-the-counter medication she can take.
Well, actually, if you have nerve damage and symptoms of nerve pain, really the only over-the-counter medications that you can take are pain relievers. And if you are in pain, it's important to take medications on schedule because it's easier to prevent than relieve pain. So ideally, for over-the-counter care, we recommend taking 2 generic acetaminophen or Tylenol 3 times daily, and if that's not enough, take 1 to 2 Aleve in the morning and the evening. That usually, however, may not be enough to help with nerve pain, because there are medications that can soothe the nerve that you need to talk to your doctor that can help you more. I wish you all well.
Well, thank you for all of your questions. If you didn't get your question in today, Dr. David will be here on Friday. But first, it looks like we have another question. Let's get in one more. Very quickly, let's find out. Barbara from Sheridan would like to know what causes decongestive heart failure.
It's actually congestive heart failure. Congestive heart failure is caused by many things. The most common is high blood pressure. It can also occur from coronary artery disease. If you had a lot of damage to your heart because of narrowing in your coronary arteries, you can have significant amounts of heart failure. It can also occur because your lungs don't work well. That's called cor pulmonale. And sometimes there's a primary problem in the heart associated with changes in the heart muscle. All of these can lead to heart failure, which is one of the most common causes of death in the United States.
Thank you for all your questions. Have a wonderful Wednesday. See you tomorrow.
Bye.